Good morning, everyone. Hope you had a nice weekend. So I guess I'll jump right into my healthcare plan, and it's kind of a basic idea. It's kind of like, why haven't we thought of this before type of issue. And the idea is a simple thing. It says, okay, well, let me think about last year. It started out, we were thinking about how, at the Capitol we hear a lot about towns saying we want more money, and we also heard people talk about we need better health care. So last year we thought, hey, you know what, maybe we could save some money by going around to the towns and having them form a pool of just municipalities, and they could buy their health care in one big group. And we figured we needed about 100,000 lives in that to make it happen. So we're trying to figure out how to make it work. So one idea, somebody said, hey, why don't you make it mandatory? Say all the towns have to join, and then they'll reap the benefits of these great savings. Well, once the towns heard the word mandate, they got a little freaky on us. And even though we said there'd be some savings, so we kind of ditched that idea. But we knew it was a good idea. We knew there was potential savings. So this year I thought, excuse me, rather than just talk about it from the Capitol and, theorize about it at the Capitol, why don't I actually go to the towns and see what they have? Not only that, I thought, rather than create our own pool of municipalities with 100,000, the state employee pool, the plan I have, already has 200,000 in it. So why don't we just open that up and make it voluntary? So rather than put everybody in and force everybody into one big group, we'll take the group we already have, 200,000 plus, and open it up. So towns could come in, towns could not come in. It's kind of a voluntary type of thing. So along the way, we thought, well, while we're at it, what about nonprofits? Because the state gives money to various agencies. Some of these are very small entities, and they pay high health insurance. Wouldn't it make sense for the state, if we're giving groups money, that they would buy health care at the best available amount? So we said, all right, we'll add nonprofits. And then somebody said, what about small businesses? They have it too. They have a problem too. So we said, okay, let's try it out with small businesses. We're not ready to get into big business yet because that's, we don't know how it's going to work. But let's look at small business because they're the ones that are hurting. So I've been on tour since November. I've been to, 20 or so different places. And everywhere I go, people are saving money. So I went to my town first, Meriden. I said, how much do you pay for your health insurance? And, it's always one of those interesting things where you say, oh, well, we have Blue Cross, Preferred, something or other, right? Century Preferred, and what do you have? And we have something on the state level. So we had to compare the right plan with the right plan. And we found out basically in my town would save, if they joined the state plan at the same snapshot, we'd save $2 million.
Wow.
We looked at Danbury, $3 million. New Haven, we think is anywhere from $5 to $8 million. Small towns like Wyndham, about $1 million. So we went to different places, and it's the same health care plan. And also, if you figure out from the town standpoint, how many bargaining units they have the teachers, they have the paras, they have the janitors, they have the secretaries, they have the other secretaries, they have public works, they have all these different people working there, and they probably have different plans or permutations of the same plan, and they have different negotiations for all these plans. We said, hey, this could be, we could skip negotiations on health care if we could just say, hey, everybody agrees to join the state plan and we're all done. Now, the beautiful thing about the state plan is, one, it's the same, there's different proposals, different prices for the various options, but it's the same plan that everybody gets. The same plan, all the coverages. So like for instance, prescriptions are $3 for generic, $6 for brand name, and you can get if it's a maintenance drug, you can get a 100-day supply of that. So you can get 100 Nexiums for $6, right? The office visits, it ranges from 10 to the smaller networks to 15 for the huge network. So I'm on the 10 plan because all my doctors are on it, so I don't have to worry about that. And the cost varies by network. So the plan's the same, and the office visits, there's I don't think there's any deductibles for hospital visits. All those different things are very minimal. So it's a pretty comprehensive plan, and the prices range from anywhere from for individual, it's like Health Net. We have Health Net, United, and Blue Cross. So they all have the same plan, but they have different providers. Not sometimes the same providers, but different networks. And the other thing is, being a state employee plan, it has to cover all the networks have to cover from Darien to Danielson, right? Because it's a state employee plan. They couldn't have a state employee plan that only has one section of the state. So it's pretty comprehensive. So the plan, the cost of the plans, what the state pays ranges from, let's say for an individual, anywhere from maybe around 5,000 to about 6,500, somewhere around there. That's the thing. And the family plan ranges from anywhere from about 13 to 17. So that's the cost of the plan. And in terms of retirees, we join into the retiree plan. So there's things like the towns could join into the state employee retiree plan too if they wanted to. So with teachers, a little more complicated, but I think if the town said, hey, we want to move our retirees, I wouldn't think there's any reason to do that. So basically, that's the kind of prices, and we're finding when we go to towns like Danbury, our 6.5 compared to their 8 something. They were paying 8 something for what we were paying 6, and they were paying like 21 for the family. That plan we looked at the 17,000 plan there. So there's different options that people have in that. Everywhere we've gone, we find savings. On the small business, it's even worse because they're paying like $24,000 for a family plan, and their copays for prescription like $40 a prescription. So it's the small businesses are like, we really need this. This is really a good thing. So the bill is going well, except we have certainly some resistance from the insurance companies. We have some resistance from insurance brokers. It's funny. I realized the other day they call themselves insurance brokers. What we used to call them?
Robbers.
Insurance salesmen, right? Insurance salesmen, right?
Yeah.
Now they're called brokers. Somehow it's a different thing, right?
Sounds nicer.
People go, insurance salesman, oh no, but now it's an insurance broker. Well, that's something different. But they're insurance salesmen, so they don't like it because people would join this plan, right? And so they wouldn't be making that money. And we think in a lot of these towns, the brokers make a good bit of dough. So the towns could save money. Instead of hiring the broker, they could hire maybe 3 or 4 teachers, that kind of thing. So the towns could save money too. So that's pretty much the plan. They're fighting it. It passed the Labor Committee. It passed the Appropriations Committee. I probably have to go to a couple more, maybe insurance and public health. And I think they should be okay there. The governor's like this. She doesn't know what to do about it right now. But I've talked to her Secretary Genario and Lisa Moody about it, and they were open to the idea. They didn't say it's horrible, but they had questions, etc. I answered them. So it's that's where it's going right now. It's not an easy fight because CBIA is against it. It's funny. They had CBIA. They put out the newsletter every week, I guess, to all the businesses, and I get a copy of it. We all get legislators get a copy. Connecticut Business and Industries Association. So the small businesses love it. Right, the insurance company. So and they actually sell insurance themselves to businesses. So this would be treading on their turf. So their funny thing, I was reading what their objection is to it. Their objection is it would extend the rich state employee benefits to everyone. I guess that's a negative thing.